Good afternoon, everyone. As you can see, I'm wearing my Browns mask. Go Browns this weekend. Why don't we start off with vaccines? As of today, we've administered in Ohio 361,603 shots that have been given. That's where we are as of today. Again, maybe to recap a little bit about vaccines. The big picture on vaccine always comes back to this: we don't have enough. We hope that this is going to increase as we move forward. We hope that will be additional streams flowing in. We have two streams now, Pfizer and Moderna. We hope the production there goes up. We also hope there are more streams that are coming in the near future. But as of today, we have to deal, like all states, we have to deal with this scarcity. Our goals. I know we get a lot of questions. I get questions all the time, and I know people wonder, when am I going to be in line, and when does my group come in? And isn't my group? Can't we make a good case for my group? And I haven't seen one group yet that didn't have a good case, but we have a very limited supply at this point. Our goal eventually is to vaccinate anybody in Ohio who wants the vaccination. But we're not there yet. We don't have the supplies yet. And we have to take this literally 1 week at a time. But what are our goals? Our goals are, number one, to save lives. Number two, to get our kids back in school. And number three, to help our first-line medical personnel who are working every day with COVID patients, who are working there to protect us. And we got to keep them working. We got to protect them. So those are the three goals. And those goals drive absolutely everything that we do every single day and every decision we make in regard to vaccines. Let's talk about the saving lives. And there's a figure that I've cited before, but I want to cite again because I think it's so crucial to understanding what we're trying to do in Ohio. 87% of all deaths in the state of Ohio have occurred with people 65 years of age or older. 87%. So we have gone at this, and we have gone at this, very, very hard. Let me talk a moment before I get to that, let me talk about protecting our health workers. That's going well. We're moving forward. We don't have them all protected yet. We know that there's some dentists out there and there's some other primary care physicians who have not been covered yet. Our local health departments are working very hard to make sure that they get that vaccine. So we're making good progress there with our health workers, getting kids back in school. We are today, just to give everyone an update, literally about almost exactly 1/3 of the kids in the state of Ohio are in class every day, 5 days a week. About 1/3 are there in a hybrid model a couple days a week, and 1/3 are totally remote. So it just breaks out. That's where we are. So we're seeing more coming back in person or in hybrid, but we still obviously have a lot of kids who are fully remote, about 1/3. So let's go back, though, to revisit the saving lives, how we're doing. We have some really, really good news. Bad news, of course, is 54% of all the people who have died in Ohio have come out of nursing homes. 54%. So obviously, that was one of the first places we wanted to be able to protect people. And we have very, very good news. We have 930 nursing homes in the state of Ohio. We are a state that has a lot of nursing homes, not just because of our population, but we have a lot of nursing homes, frankly, because if you base it on population, we still have a lot. So 930 nursing homes. We have partnered with 4 different pharmacy companies, and we checked back with them within the last few hours. Here's where we are. And we work with them every day, and we're very happy with where they are. CVS reports that they have gone now to 97% of the nursing homes that they were assigned to give that first shot out. 478 facilities they were assigned to, they only have 10 to go as of the beginning this morning. Farm Script, they have done 61 of 63 nursing homes. They have 2 to go, and they're doing them today. Walgreens, they've done 95% of their 398 facilities that they have been assigned. So we're very happy about that. They put more shots in more people's arms in nursing homes in Ohio than in any other state in the union, and they're working many, many other places. Finally, Absolute Pharmacy, they're done with the first phase, 100% of the nursing homes. So that is the good news. They're going to go back now with the second shot. Some of them have started back, and additional good news, anecdotally at least, what we're seeing is when they go back into those nursing homes the second time, we're seeing more staff take it, and we're seeing more residents take it as well. We don't have the exact numbers, but we're seeing an uptick in those numbers, which is very good, and we're very pleased with that. We have, according to the federal government's figures, we have administered in Ohio better than 8% of all vaccinations that have been done in nursing homes across the country. So we're 3-point-something% of the population. We're over 8% of that number of vaccinations in nursing homes. So done very well here. Let me go continuing on the theme of saving lives. Again, a statistic that I cited a moment ago, 87% of all deaths come from those 65 years of age and older. So we have people in nursing homes, and we just told you about that. But we also, of course, have people who are not in nursing homes, who are out in the community. So we will start this coming week with people 80 years of age or older. We hope, we'll see how this goes, every week to move down 5 years. So we start with people 80 years of age or older. And let me kind of walk everyone through that. The shipments come into Ohio beginning on Monday. They arrive on Monday, Tuesday, and Wednesday of each week, and they go out to the different locations. So we have told the federal government, we have told the pharmaceutical companies, we've given them 750 locations. So if you are 80 years of age or older, beginning Tuesday, Wednesday, and Thursday, you have those locations are available. Now, the caveat is, and we've talked about this before, but not everyone 80 years of age is going to be able to get a shot next week. The numbers just don't work. We have about 100,000 vaccines. We've spread them out across the state. It's a question of equity. We want them in every county. We want them in every part of bigger counties so that people do not have to drive very far or go very far to get a shot. But we only have 100,000 for next week, and we know there's 425,000 approximately people 80 years of age or older. So we can do the math. It's going to take a while, but we want to get started. And frankly, we want to give our 80-year-olds who have the most risk, at least a week, get that week head start and to start down that path. And we frankly want to see how that works the first week. This is going to continue to be a work in progress as we work our way through this and try to deal with the scarcity issue, but also try to make sure that people are fairly close to a place that actually has it. How will people find out about this? This process is started. It's not done. Local health departments, some of them announced yesterday the locations that would have the vaccine in their county. Other health departments will be announcing that today, and maybe even some tomorrow will be announcing those. So the media is being informed county by county by the local health department. So that's something you'll be able to see in your newspaper, maybe watch on TV, pull that online. Second, we've asked every health department to be up by tomorrow morning on their webpage with the locations in their particular county. Number three, tomorrow morning, we will go up on coronavirus.ohio.gov, coronavirus.ohio.gov, and you will be able to pull down and look. You can search it by county, or you can search it by zip code, and it will tell you where those locations are. It will be up to those individual locations that have the vaccine, that will have the vaccine, to do their own scheduling. This is what the way we're going to start this out. As I said, it is a work in progress, and we will see how that goes. Now, as I said, each provider, I want to emphasize this again, each provider will do their own scheduling. Some caveats. Not going to be enough next week for everybody, but our goal is to get as many 80-year-olds vaccinated for their first shot as we can next week. I know we're very happy to get started on this very, very vulnerable group. We prioritize those individuals who candidly are the most likely to have a bad outcome, most likely to face a high mortality rate than other people. It's based by age, so 80 and older. Next, we will continue to learn. We will continue to adjust as we go through. One of the driving forces for us to do this decentralization and do 750 sites across the state of Ohio is equity, racial equity, economic equity. And we wanted, instead of having one or two big sites, for example, in our urban areas, and we may come to that, to add those to what we already have, and we believe we will, and we're working on that now. But we felt to start with the limited amount we have now, putting it in neighborhoods, putting it in local pharmacies, putting it in local health departments, putting it in federal clinics around the community was the way to go. So we know that in rural areas, this is going to be different than it is in urban areas. In a rural area, a small county may have 3, 4 locations, and that's going to be a lot simpler. We know that in an urban area, it is not going to be that easy, and that there are going to be many, many choices, and that people will have to navigate that. And we understand that that will cause some frustration. We decided to start that way, frankly, because we did not want to see what we've seen in some other states where they have one huge center or several big centers. People show up and they wait for hours and hours and hours. So the frustration for us probably is going to be on the front end in our urban areas where they have many choices, where people try to either get online or they try to call and schedule an appointment. Once they make that connect, however, and get the appointment, it should go a lot easier than it does or would if we were just doing central sites where people can drive up to. Now, as I said, we will move to a combination, a hybrid system in a few weeks as we get more vaccines in. We hope we're going to move to the opportunity to have more big sites where people can go to, along with the more neighborhood or more local sites. We will learn, we will adjust as we move forward. We are in the process of trying to and working on a state central scheduling system. There were some, frankly, that we could have taken off the shelf. We have seen problems with some of those. Our advisors told us, and our best estimate was, that we need to not do that because that would cause some real problems. We want to make sure we got this right before we put this up. So that is how we're gonna start off.